So here's a video on intent, comparison between doctors. This is medical doctors, chiropractors, or chiropractors and chiropractors. And when you look at the definition for medicine and what they're trying to accomplish, it's the practice of diagnosis. They're trying to diagnose a symptom. So they'll ask you questions. Where does it hurt? How does it feel? What kind of symptoms? And they'll do all kinds of testing, blood work, scans, MRIs, urine analysis, any kind of test they can do and look and say, something's wrong right here. To diagnose you with something, a condition, to then treat. And that's where the treatment comes in. So they give you a treatment, and one of the intent is prevention of disease. And I see that and I think, is it really prevention of disease when they manage diabetes and allow you to have diabetes for a lifetime instead of changing your lifestyle, your diet, or your body habits to eliminate diabetes? If it were me, I'd want to eliminate it. So what is their intent? A few patients asked me lately, they said, your adjustments are so much different than other chiropractors. What is it? What's the difference? And somebody else said they may want to be a medical doctor, a DO, so they can do both. They can both adjust and they can give medicine. And I said, you won't though. And I said, you won't be proficient, you won't be good at adjusting because that's just not what they practice. They do some general manipulation, but nothing what I do. And I said this to her, said my intent may be way different than a chiropractor's, and it's absolutely, completely different than the medical profession. Two different things. What is their intent? To treat a symptom, a condition? At what price? There's side effects to the medication that actually cause more disease, more sickness. So if I take a blood thinner and my blood gets too thin and I bleed internally and I die from the internal bleeding, my blood was thin, so they treated me with success, but the side effect was a disease. So is it really prevention? This can be true for chiropractors as well. Are they treating you just for back pain? Are they treating you for just your aches and pains or your symptoms? See, that's not what I do. My intent is inside this vertebrae is a nerve attached to the spinal cord, connected to the brain. You have an innate ability to function and heal. If I skin my knee, and the very same day that maybe I had a surgery to my spleen, and they had to stitch up my spleen, my body has to produce new spleen cells to regenerate and new skin cells to regenerate. How does it know the difference? It's all up here. Program. If my body's trying to fight the stress of bad food or plaque, how does it know to do that? It's all up here through the nerve system, through the spinal cord nerve system. If this system gets interfered with in any way, shape, or form, through bad posture, through what we call a subluxation, when the bone shifts out of place and grabs onto that nerve, if that pinches or blocks nerve flow, you're blocking mental impulse from the brain through the nerve system for innate healing. That's where the healing comes from, not from the medicine. And the healing doesn't come from the adjustment. The adjustment is to remove an interference so the brain can reconnect to the body part 100% purposefully to correct it. To correct it. You can't do that with a medicine nor a vitamin, and I can't do that with trigger point therapy. I can make you feel better. It's not my purpose. My intent is this, and this is where we differ. My intent is to remove interference, to adjust the spine so the body can heal. And when I was thinking about this with my 5 kids, when they were growing up, I did not want to depend on medicine because of the dangers of medicine. I fear medicine. If I could keep them in alignment, keep their nerve system functioning optimally, as close to 100% as possible, then their body will have the ability to heal and fight all disease and all sickness. And it's worked beautifully. Medicine should only be used in such a dire strait when our body just doesn't have the capacity or capability to heal on its own. It's been damaged too much. It's been hurt too much or neglected too much. 20, 30 years of bad eating is going to lead to cardiovascular disease. An adjustment's not going to help you at that time. You may need surgery. But what's going to heal you is the proper lifestyle, proper nerve flow. Nerve flow is by far more important than diet and exercise and sleep. Without nerve flow, you're dead instantly. So my intent is to allow the body to heal at the highest level. That's not what a medical doctor does, and that's not what a lot of chiropractors do, because their intent is to make you feel better. I want you to feel better. It's not my intent. So you have to ask yourself, who do you want on your team for that? What do you want? If all you want is to feel better and you don't care about your future, a lot of doctors can do and a lot of drugs can do. But if your goal is to repair 100% every time you're damaged and injured and keep these organs 100% functioning, you need a principal chiropractor to investigate your spine to make sure it's in alignment and make sure you're adjusted in alignment so you can heal at the highest level, period. And this is for life. If this is blocked in any way, shape, or form, you're diminishing life every single day. If your child has subluxation, nerve pressure, they're not going to feel it for 5, 10, 15, 20 years until they express sickness. And then you say, well, now I guess I can take my child to the chiropractor. That's like allowing them to eat French fries every day, waiting for a heart attack, and when they do, then you go ahead and have the bypass surgery. It's ridiculous. Once you understand that principle, then you have to look and say, I want the highest level of healing. That's what chiropractic does. That's the highest level of chiropractic, in my opinion, and that's how powerful it is. When I applied that to my life and my wife and my kids, we've healed at a very high level without drugs, without surgeries. So when they ask, what is different? When I apply an adjustment, and I give an adjustment to the body, I believe there's healing being restored immediately. All through the body. When I take pressure off the nerve, the brain can now get to those body parts and heal. Whether it's a meniscus tear, heart damage, acid reflux in the stomach, or colon problems with Crohn's, when I eliminate the pressure over time, the body's going to heal. So you need to be realigned over and over to keep in the highest alignment. Not just one adjustment and you're done. It's like one exercise and you're done. It's never going to happen. That's the difference. And I believe when I lay my hands on somebody and I make that adjustment, that application, that side, call it spiritual, call it innate, is connecting. They feel that and they know that. That's why they ask me, and I had it happen many times. What are you doing different? They never adjust me like that. And I think it's that. So I hope this helps. I hope this inspires you to see a chiropractor, get an exam, and believe that you can heal at a very high level. You just have to apply it, and apply it for a lifetime. God bless. Have an amazing day.